Commissioner Shelton, do we have the county numbers?
Yeah, we have some numbers from the county. County's internet's been down all day and IT's working on it, but here's the numbers I have so far. Active, we have 1,129, recovered 816, confirmed 1,370, probables 594, and there's been 19 deaths. I believe Dr. Benton's on, and he's going to give some more details on the deaths that we had over the weekend.
Dr. Benton, go ahead.
Yeah, actually, I do not have the total on that, Commissioner Shelton, just yet. I had an update at one point in the weekend where there were 6 deaths, 4 at medical center and 2 at ORMC, and 4 of those were Ector County residents. 1 was from Kermit and 1 was from San Angelo. But that was from Saturday. I haven't had an update today.
Thank you, Dr. Benton. Russell, when you'd like to go over the MCH numbers?
Yeah, good afternoon, everybody. So far, Medical Center has had 694 positives. Currently, we have 47 COVID positive patients in the hospital, 47 today. 10 of those are in the CCU, with 5 of those being on ventilators. We have 5 in the Wheatley Stewart building across the street. That was our overflow. All 5 of those are on ventilators as well. We have 16 on 7 Central and 16 on 8 Central. On these patients include, we have 11 from the Sienna Nursing Home. So 11 of our 47 are from one spot. 2 are from Focus Care Odessa. 2 are from Pecos County Hospital. 3 are from Andrews at Permian Regional, 1 from Reeves County, and 1 from Rio Grande City. So that's quite spread out. That's quite a bit of territory we're covering there. We've had 2,948 negatives, 436 pending, no suspects in house, and over 4,000 tested at this time. Also, Trevor, do you have the info from the J and K rack available to look at right quick?
Yes.
I showed this last week. Just a quick update on this. Here is your situation report for J and the K region. Again, this shows all the hospitals, their current census, their COVIDs, their vents. Down at the bottom is what we have been focusing on, which is the healthcare stress score. If you remember, last Thursday, that was over 60%. So we have seen a slight bit of improvement in that risk and the stress score down there. But you can go through, quickly look at these, tells you what the census is and what the COVID load is. So Medical Center 47, Midland Memorial showing 42. What about you got Odessa Regional 16? We'll see how current that is when they report here in just a minute. One of note, San Angelo, Shannon, their number went down pretty good. They were over 40 last week. They're at 31 right now. But this, we just keep an eye on this score. And I thought this was worth looking at today. And with that, I will turn it over to Kristen, if you got anything.
Nothing in regards to numbers or the patients, only that we put out our plea for staffing today to just really tell our community heroes, nursing, respiratory therapists, that we are accepting those people with active license to come on board, take a temp contract with us. We know we have lots of experience, lots of great caregivers in our community and on our surrounding communities. So we just wanted to put out a plea to any of those local heroes, if they could come on board for a 10, 12-week contract, that we would greatly benefit from their hands here at the hospital.
Trevor, I also reached out to our retirees last week. I called their group and told them if there's respiratory therapists, phlebotomists, nurses, if you want to come work a couple weeks on a contract for those retirees to come on back and let us get you back up to speed and back in the saddle and let us put you to work, because we need them. So we know our retirees have a lot of knowledge, and some of them are still scooting around and have time on their hands. And so if they're interested, come see us and let us put you back to work.
Thanks, Russell. Kristen, Stacy, you want to go over RMC numbers?
Yes, thank you, Trevor. Odessa Regional has tested 1,254 individuals. 232 of those are positive, 997 negative. We currently have 25 pending. We have 16 patients in-house with 10 of those on ventilators. And then 13 of those have come from home. Two still from Courtyard and one from Big Spring. And then in terms of staff, we have 16 staff out on isolation. 13 of those have tested positive. 4 have been returned to work, and we currently have 9 on isolation, and every one of those are community acquired. We did have, over the weekend, as Dr. Benton said, we did have 2 deaths, and so our thoughts and prayers are certainly with those families. We had 5 discharges and 5 admissions, so that's where we stand based on where we were when we were all last together. That's all I have, Trevor.
All right, thank you, Stacy. Dr. Saravani?
Sure. Thank you, Trevor. You've heard me talk a whole lot about Dr. Dar, who's our provider who provides all of the care in our COVID unit. I figured it would be very useful for everybody to hear directly from him. So I have him here in my office today, and I'll have him speak a little bit today.
Good afternoon. I just wanted to take this opportunity to mention a few things. One is, the provider's perspective on this disease, and it's a very difficult illness to treat, as we all know, and for several reasons. One is very labile and volatile nature of the illness. As an example, last Friday we spent about 6 hours in the COVID unit in what I would call organized chaos. I mean, it was just rapidly deteriorating patients and requiring multiple interventions through nursing and providers. The nursing, we've talked about nurses and their role, and I can't say enough about them. That particular day, I got to witness that firsthand. And they stepped up in a way that I was really proud of. The second reason is that treatments, there aren't really any good treatment options available. We talk about plasma, we talk about remdesivir and then Actemra, but really none of those modalities are of any real proven benefit. We use remdesivir in most patients, but plasma, we're finding more and more that is relatively ineffective, that the course of the illness is beyond our control. We provide supportive care, and that's about all we do. We, as physicians at Medical Center and here, Dr. Agari, Dr. Hu, Dr. Azaroff, and Dr. Bastidas, we communicate with each other all the time, looking at what we can do locally and what our experiences are. And we try to share those. We look at data from New York, from New Orleans, from Seattle, and from friends in other places. But we've yet to come up with a protocol that we can apply to everybody at the same time. The third most point I wanted to make was that the lack of family members at the bedside is also a big hindrance for several reasons. One is that it used to be easy to communicate with them at the bedside in an ICU setting. Now it's a little more difficult. We have to call, and not having that visual there.
Oh, I think it rose.
All they see is a man or a woman with a mask and a shield and a gown and a cap, and so it's difficult for them to understand what's going on, especially if they're medicated and on ventilators. I guess that was all.
Thank you very much, Dr. Dar.
Thank you.
Thank you, Trevor, for allowing Dr. Dar to be on here. Thank you for coming, Dr. Dar.
All right. Thank you, Dr. Saravanan. Mayor, do you have anything to add before we get to media questions?
I'd just like to reiterate what we've been saying week after week after week. Make sure everybody's wearing a mask. Make sure you're washing your hands. Make sure you're social distancing. And if you feel sick, please stay home and isolate yourself until you can determine whether you have COVID or not. Because we need to make sure we try to do what we can into the fall, especially to get most of the kids back in school. So that's really all I had, Trevor.
All right. Thank you, Mayor. Dr. Benton, did you have anything you wanted to add before we hit the media questions?
Were you asking me, Trevor?
Yes, sir.
Yeah, no, I didn't have anything additional. Thanks.
Okay. All right. So let me go down the list here. We got a bunch of people in the house. Looks like first up, so always at the top, Mike from the Odessa American.
Yeah, hi. I guess this question would be for Russell. I heard that some MCH patients had asked for Dr. Bartlett's treatment. Do you have anything to share about that?
Let me get off of mute before Trevor reminds me. Yeah, we have received several calls from patients' families and from the patients themselves about this regimen that's has been viral all over the internet. Dr. Bartlett has done a very good job of getting that information out there. As you know, these doctors that we work with, just like the good doctor spoke about earlier, man, it is organized chaos. And so I will tell you that this past weekend, we did deploy that regiment at a patient's and family's request here at Medical Center. And when we deployed that to the patient, that patient has shown no change. So it was deployed with the condition, no change in the patient condition. And I'm working to confirm that we have given that to a few others, but right now I'm only able to confirm that Medical Center did deploy that to one patient, and there was no change in the reported condition.
Right, and I guess what inspired you to do that? Was it are you just looking for something new, or was it just because of the family's request?
Well, I'll let Dr. Benton. I've been called a lot of things, and a doctor is one of the nicest things I've been called. But at the same time, I've told my providers and doctors that take care of me personally, look, when I'm sick and I'm in the ICU and if I'm on a ventilator, I want you to throw everything you can at me as long as my body can tolerate that. But that's me. I mean, and I think our doctors and definitely the doctors in this community are very sensitive to what is going on in our community. I think that they want to be backed up by science. I think that they want to be safe with the patient and what their bodies can handle. And but I think that even with situations like this, that nobody can say that this hasn't been tried in the hospital level, because it was, and it has, and the outcome was the same. Dr. Benton, do you want to add anything to that?
Yeah, I don't know the exact circumstances of this particular patient and physician relationship, but that's really what it comes down to, is each individual patient and physician relationship. From an administration perspective, we don't determine at that level what that doctor prescribes or doesn't prescribe. So, they make their choices between family members and the patient and the physician.
Okay. All right.
I was just going to say that, I'm sorry, in an outpatient setting, perhaps, because we have nothing else to offer. So I'm not for it or against it if patients want to try it. In my clinic setting, if patients want to try something they get off the internet, as long as it's not going to interfere with their other medications, I have no problems using it. But in an inpatient setting, I think it's a little different. As far as steroids are concerned, we do give steroids to everyone who's on a ventilator. So I'm not sure the addition of inhaled steroids is going to be of any more benefit. But as an outpatient, certainly, if that's the patient's choice, for sure.
Thank you,
And
Dr. Dar.
I would agree with Dr. Dar. There are a number of patients that we have given steroids to either by mouth or intravenously. And you have to remember, yes, this is a lung infection, but it is a total body inflammatory process as well. So it would make sense that giving steroids systemically or to the whole body would potentially be more effective than just inhaling them.
Dr. Benton and Dr. Dar, pardon my slang terminology here, but does this seem more like, to both of y'all being the doctors and the professionals, that this is more of a pre-hospitalized treatment than a treatment that is, for hospital treat? You understand my question, what I'm asking there?
Yes, exactly. If patients want to try it as an outpatient, if we had alternatives, it would be different. We don't have alternatives. So if they wish to try it, it's their choice. It's just that two things I want to point out. One is that we've had patients who've tried it and then ended up in the ER in very sick conditions. So as long as they realize that if things don't improve quickly, they ought to get help. That's an important thing. And the rest is, if it works, all power to all the prescribers and the patients.
Pardon my slang.
That's an important thing.
Looks like somebody's on replay there.
Somebody's got a serious delay.
I would agree with you, Mr. Tippin, in principle, that by the time you are hospital sick, it's a bigger infection and spread more broadly through the body, a viremia or virus within the bloodstream. And so systemic or body-wide steroids wouldn't have better potential.
Mike, anything else?
Yeah, so is this something that patients would have to ask for, or is it something that doctors at MCH and ORMC would, I guess, refer them to?
I wouldn't necessarily prescribe it, only because, we have other modalities of administering the steroids. The other thing to remember also, inhaled steroids are basically meant for airway disease, and this is basically an alveolar process. It affects the air sacs, so you really need something intravenously or orally that's going to affect the whole body and hence the lungs.
Okay. Well, thank you, Doc. I have a question for Mayor Turner. I know you said you'd be reaching out to Abbott this week regarding the whole shutdown talk. Is there any updates on that? Have you gotten a hold of him?
I probably personally will not talk to him. I've reached out to Brooks Landgraf, and I'm going to reach out to Kel. Haven't heard any more about it. So I don't think it's as big of a threat as everyone thought. But if I hear anything, I'll let you know.
Okay, thank you. And for Eddie Shelton, were those the most up-to-date numbers, or are we going to get another update today from the county?
Well, the website will be updated at 5, and these are the most up-to-date numbers.
Okay. I was wondering if you knew when, I guess, the public can get those numbers at 3 by the hospital briefing, if that's something you know or anyone from the health department knows.
Well, it's not something that we're trying not to do. We're having growing pains at the moment. We've hired 23 already and transferred 2 more from within the county. So now we're working on places to set them up and train them and get them all to working. So, it is our goal to have these numbers to you by this time. So we are working towards that goal, and we'll get there just as soon as we can, Michael.
All right, thanks. And I guess the email from last week said that y'all were trying to get people moved into the health department. Is that, I guess, what does that mean? Are y'all moving to a physical location, or just trying to get things set up again somewhere else?
Well, so we were set up at the senior center, and so now we've got more people, and so we're going to set up at both places with the more people.
Okay, and that's the South Side Senior Center still?
Yes.
And the health department?
Downtown, yes.
Okay, all right. And yeah, thank you. That's all I have today, so I appreciate it.
Thanks, Mike. Looks like next one up is Mitch.
Hey y'all. Kristen, my main question is for you. You know, I know you spoke this morning and I couldn't make it to that press briefing, but just in general, for the general public, how alarmed should people be that that MCH is asking for, you know, putting out such a public request for people to come in and, you know, help out with the coronavirus pandemic?
I wouldn't say that there's an alarm. It's just us being proactive. We have nurses here. We have travel nurses on their way. We have lots of PRN staff. And of course, we have our leaders that are here and can step into roles as well. This is just us being proactive, knowing that the 4th of July, that 14-week period is going to be coming. The influx of patients week over week of recent has really increased. And so we're just trying to be prepared so that when we do get another influx of patients, that we're ready for that.
And I'm curious, you know, how are y'all planning for the fall as, you know, the temperatures get colder and a lot of people believe more groups will start gathering indoors, which could cause like the second wave? And I guess, how are you planning for staffing needs in the future past this, like, you know, kind of holiday sweep we're seeing right now?
Well, it's the same type of thing. We're working on hiring. Several of the nursing schools are graduating classes in July and August, and so we're onboarding those. We're doing some outside recruitment, not just from our local areas, but also from within the nation, just to see, you know, anybody that's looking for a job. So we're really trying to enhance, if you will, our recruitment patterns so that we aren't calling on local people to come in and do these contracts. But many times in the winter, we call it winter readiness. We do the same type of thing as we get certain patterns of different groups of people to come in and work for us for a short period of time.
And just to be sure, how many positions are you looking to fill at this time with the temporary workers from the community?
So what I've told everyone this morning was I haven't set a number.
Okay.
The more hands that I have on deck, the better. And so when we get to that bridge, if I have to say, whoa, hold down, I don't have any more places, then I'm doing something right. So we're going to just keep the door open until we feel like we've truly got enough to give everybody a breather and to take care of our patients, and then we'll kind of reevaluate.
And for ORMC, are you guys looking at similar recruiting tactics for looking at community members to come on board, or are you guys okay right now?
Well, we are looking to add additional staff. We've done many of the things that Kristen mentioned that Medical Center is doing. We have asked our leaders to step up. We also have non-bedside nurses who are in more of desk jobs, if that makes sense. And so we've asked them to help as well. And then we also have some agency here and more agency on the way. And so we're doing pretty much all of those same things that Kristen mentioned. And it's a very much a state of readiness. We don't know what's going to happen from here. We do expect that it will be worse in the wintertime, and so we're trying to plan for that now to make sure we have the appropriate resources.
Is there kind of a light at the end of the tunnel, at least with this summer spike, since there's a mask mandate now? I know in Midland, which is where I live, I've noticed a lot more people wearing masks. So are y'all hopeful that there, you know, once we get past the cases from July 4th, that there may be some kind of reprieve, or are you guys not thinking that far ahead at this point?
We're hoping for sure.
I think the next thing we got to prepare for is the baby boom come about December.
So, Mitch, yes, I think we're definitely hopeful because the mask mandate will make a difference. Remember, it said that before we would look at our community and say maybe 5% of the people are wearing masks. Now, that number has increased 10, 15 fold. So if you look at that many people wearing masks, you can imagine it would probably take about a week, 2 weeks to sort of reflect in that population. As long as there is no heavy, sharp rise because of the July 4th weekend, I would say probably week to 10 days from now, we'll have a good sense of what it's going to look like for maybe the next 4 to 6 weeks, as long as that is still continuing. Now, if it gets worse, remember the governor is going to push farther and farther, and probably more and more things will kind of close down or be limited. But at least for now, the masks, we kept pushing the whole time that's the one thing that people can do that would make a difference. And so hopefully at least that will show that it'll make a difference about 10 days from now.
Well, those are all my questions. Thanks y'all so much.
And next up on the list looks like Tatum.
I'm gonna make it real easy. I don't have anything. I'm just listening in today.
Okay. All right. We'll stop that video. And then I think next is Scott, who's been trying to join. And Scott, you there?
Yes, sir. Can you hear me?
Yes, sir. We can.
All right. I think I'm set. Bad Wi-Fi on my end today. My apologies. Mr. Mayor, do you know how, off the top of your head, how many people have called 911 or reported folks not wearing masks since you started the mandate a few days / weeks ago?
No, but I can find out. I can have Devin call.
That'd be cool. Thank you very, very much. Eddie, you worry me that you're having to broadcast from a closet today. Is the election that stressful?
Let me tell you, the election is stressful. COVID didn't help. I left my laptop in my closet, and so I hurried home and turned it on. Plus, I'm proud of my closet. I'd like to show it off.
It's very organized. I think they call that type A. I just wanted to ask.
Can you pause real quick? Sorry, we're frozen. Yep, sorry. I don't know why it froze 30 minutes in today, but I want to make sure people can hear your questions. Give me 2 seconds here. Sorry about that. Make sure people hear you. Okay. Sorry about that, Scott.
No problem.
Okay. And we are back up again. Just give people a few seconds to join in. And all right, people are joining back in. Go ahead, Scott. Sorry about that.
No problem. I just wanted to ask the hospital folks, Dr. Bartlett's silver bullet story is still the top 2 stories on our analytics today. And Russell, you addressed it earlier. I think the complaint we're getting the latest is that the hospitals are refusing, hospital administration is refusing to administer this treatment. Obviously, Russell, that's not true because y'all did it over the weekend, right? Mute.
You're on mute.
So no, nobody's refusing to give the treatment, but as you heard, the doctor talked about treating patients over the last several months, he knows which ones have shown him some level of efficacy in controlling this disease process and which ones haven't. And there may be a place for it, like he said, in the outpatient setting. That's yet to be found. Let's wait for the scientific literature to catch up and give us that. But with regard to inpatient, when somebody is on systemic steroids, which means if somebody is getting steroids through their blood directly or by mouth, the dose of the steroid in the body is so high that a minor dose of inhaled corticosteroids is going to have no additional impact. So there is no reason to give these medications. They may have a great placebo effect for patients because they feel like it could work for them, and we're happy to use any effect, whether it's placebo or whether it's real. We're happy to use any effect we can get out of a drug to get people to get better. When a patient is ventilated, though, means on a ventilator, at that point it makes no difference. There's no such thing as placebo at that time. Either you're going to get better or you're not. And so we do a lot of these treatments that Dr. Dar was mentioning. Not every one of them is proven to work every time, but these are the ones that we have the most amount of data on. So we're willing to try a few of these, which we think is appropriate for that patient at that time, to see if it'll make a difference. It's hard to say. Each patient is so different. The same age group, we've talked about this before, same age group, same medical conditions, they'll act very differently to different treatment plans. So it's hard to predict.
That's what I was going to say.
Well, I think what's concerning to me is that reading comments on various websites, that this is almost turning into a conspiracy theory, that there's a guy who has what he claims is a magic bullet, who's gone as far as to call it a cure, and people think you guys are just choosing willy-nilly not to use it.
Yeah, the majority of the scientific community, Scott, believes very strongly in evidence-based medicine. And that means that it needs to be proven at many different sites, at many different times, reproducible in time and space, to be able to show that something works. At the same time, we all, because we believe in evidence-based medicine, we all understand that innovations come from anywhere. And so the scientific community is evaluating each of these treatments as they come up. The problem with conspiracy theories, how you put it, the problem with that is that some people are going to hang on to an idea whether or not it has factual backing to it because it sounds so good. And, you know, I don't want to say the cliche, but if it's too good to be true, maybe it is too good to be true. But that's not the point. The point the scientific community looks at is, if it is something that could be good, we want to evaluate it and we want to see if it'll work for our patients or not. And we would be the first to jump on board if we felt like it was going to make a difference for our patients. When people bring up, why don't you try it on everybody? Well, we have to have a reason to try it on everybody. I just explained to you from a scientific standpoint, if someone is on steroids systemically, inhaled corticosteroid is not going to have an additional impact on that patient's health. That's just science. And so we won't try it routinely unless someone specifically comes and requests it. And we don't do it because we think it'll work. We do it because they specifically requested it.
Do you think the way he's handled this has made it more difficult to navigate this pandemic?
Yes,
locally?
I absolutely think the way it's been handled, not just by the doctor, but more importantly by the media, is a problem. And because if you showcase ideas such as this, and unfortunately the words he has chosen to use, and I've read his paper, I've read his white paper that he has talked about so many times everywhere, that's on all these people's desk. I've read it. And I'm telling you, from a doctor's standpoint, the majority of the scientific community will not accept something like this as a treatment for all people created equal. Because even the treatments that we are giving that are proven by, not proven, that are recommended by the NIH right now are not working equally for everybody. So there is no way to claim that a drug such as Pulmicort, which is actually very cheap to give, so that there is no obstructionistic view from a hospital standpoint, from a doctor standpoint, it really is not going to do a whole lot of harm in someone who's getting a high dose steroid. It doesn't cost a whole lot to give, so there's no reason for us to put up a fight against this medication, obviously. But what we should put up a fight against is the belief process of the fact that this could solve all problems. No medicine is ever created that way.
And I want to make it clear to those who are watching on Facebook this afternoon that we, as CBS 7, have reached out to Dr. Bartlett numerous times to follow up on the original story we did. I've even texted him personally, and he refuses to call us back or text back. So I want to make that very clear. My final question is, as somebody who's sworn to do no harm, isn't this causing harm?
No, and I just explained that, Scott, is because of the high dose of steroids already in the system, an inhaled corticosteroid would do no harm at that point. So the only reason we would even entertain giving this medication because of the patient's request is because we know that it'll do no further harm. We don't think it'll do any good, but we don't think it'll do harm. So we'll give it just to satisfy.
Doc, I guess I meant my question in a broader sense. Is it like the way he's handling this, the way it has taken off on social media, instead of being backed up by science, it's being backed up by everyone and his brother's opinion on Facebook? Isn't that doing harm? And he knows that.
Yeah, I mean, I don't think you need my opinion for that. I mean, you guys can all form your own opinion on that.
Okay, that's all I have. Thank you.
Got it. And I think that's pretty much everyone. Does anybody else have anything they'd like to add or ask before we come back on Wednesday? No? All right. Russell, did you want to finish us out, sir?
Yes, sir. Of course, our thoughts and prayers are with those that lost loved ones over the weekend. May the Lord comfort those folks. Matthew 22 says, Jesus replied, love your Lord your God with all your heart, soul, and mind. This is the first and greatest commandment. The second is to love your neighbor as yourself. Have a good afternoon.